everybody. This went a little bit more smoothly, didn't it? Well, welcome everybody to the Patient Better Show, where I teach everybody how to self-manage their care more efficiently and effectively. So, good morning. Well, today we have a big schedule on our plate because we're going to talk about why being self-certified matters in Patient Better and what this means exactly to people. So, let's go ahead and just talk about the overview and then go from there. So, what having a patient better certificate means to patients is they're able to understand the healthcare system more and how to navigate it more efficiently. What does that mean to people? When you're certified with that, all you have to do is go to your healthcare professionals, and in a nutshell, it just gives them a balance sheet, really, a snapshot of what you know and what you don't know. So they're able to talk to you on a higher level just because they know where you're coming from. When you say that you're a patient better certified, we actually certify you with our nonprofit organization. That is an actual certification, means that you have got the fundamental education to navigate the healthcare system more efficiently and effectively. So that's a really cool aspect of it. But that really brings healthcare professionals, because you really have a very short, limited time to talk with them these days. And you know how it is. You're slow walked from the waiting room all the way to the treatment room. When you get into the treatment room, they do a lot of preliminary stuff. They talk to you. They get your chief complaint ready. They do your vitals and stuff like that. So that way, when you have the doctor's time with them, it's a very kind of streamlined efficiency. Well, if you tell them that you are certified with Patient Better, all of a sudden you got all of this other stuff kind of like backed away. So all the things that they're thinking, oh my goodness, does my patient know this? Does my patient know that? Well, then all of a sudden they have that information. They know that they're able to talk to you on a higher level, and they get that out of the way. But one thing we need to do prior to getting into this show is we need to thank our Lord and Savior to having this moment together and being together, um, and working together and making our lives better. So, with that being said, I wanted to share with you about a couple of verses that I've been working on this week, and I really thought it resonated with me this week, and I've been working on memorizing them. Um, but I thought it would be a great thing to discuss. This is going to be in Proverbs 3, verses 5 and 6. And with that being said, it says, and this is King James Version, by the way, so trust in the Lord with all thine heart, and lead us not into thy own understanding. Verse 6, in all thy ways acknowledge him, and he shall direct thy paths. So when I was creating this show today, or even this week when I was preparing for it, one of the elements that I needed to put into this show was, of course, our Lord and Savior, because this is actually what he is doing for us, but a way that we can always get a chance to worship him. And that's what means a lot to me. And I'm really glad to bring this to you guys. And I'm really glad that we can share this moment together, and we can work on taking care of our health and lead a more godly life. So, with that being said, let's go on to the next thing of what uh, having a patient better certificate means to patients. So, when you have a patient better certificate, you are able to gain confidence in managing personal health and making informed decisions. What does that mean exactly? So you've got the basics down, and it's only like a 5 hour, 23 hour 23 micro lesson course. So you're taking it's like 5 minutes or something. You'll be able to ace tests and stuff. But after you get that, after you get the certificate, you know these three basic things. Number one, access your patient portal. Huge game changer. When you are able to access your patient portal, not just to your primary care physician, but to all of your physicians. And if you use that tool that we talked about last week, the physician list or the provider tracker tool, you are able to understand, navigate. And what I consider those patient portals is to be like a doorway. You know, there's some doorways that you go into medical office practices that are huge, glamorous, and you walk in like $1 million, right? And you've got a water fountain, have a maybe you have a fish tank or something like that. It's that, and then you also have a very modest, physician's office where you walk in and the door is pretty standard. It's probably standard door from the building and stuff like that. You walk in, and it's pretty mundane. Well, patient portals are kind of like that. They're like a gateway, a door, just a basic door. So some of them are really glamorous and sophisticated, and you're like, oh my goodness, and very intimidating. And then you have some that you're like, okay, I understand this. This is very modern, very straightforward, and very easy for me to navigate. So you have the sophistication levels, like a door, very, very, modest to your very elite and intimidating. And that's kind of like the portals too. So we're here in Houston, so like a Methodist, you know, and you're navigating through their portals and stuff like that, and you've got every physician and every, a possible specialty, and you could just go in and stay there forever. And then you also have your primary care doctor. So if you're living in a smaller town or something like that, definitely going to Houston is not an option. And just to get your blood work and stuff like that. So then you have a more modest little door. So anyway, I go on. So your patient portals are kind of like doors. The second thing is that you're going to have to know why you are in the doctor's office. And as I was a sales rep, I would go into the doctor's office, whether I was selling drugs or whether I was selling devices, and I would go in there, and a lot of times I would see patients and they would be completely discombobulated. They'd be like, I don't know why I'm in here, blah, blah, blah. And I'm sitting there thinking to myself, I do. It's because the electronic record told you it was time to come in. But that's just a system. And I'm going to, matter of fact, leave an article about that, about these scheduling systems that don't really have an answer. They're just kind of automatic. And patients will, do that. But anyway, without having a chief complaint, knowing why you are there, other than having just your scheduling service, prompt you to go make a schedule, you want to make sure that you're in there for a reason. You don't want to waste your time. You don't want to waste your parking. You don't want to, be in extra space in the hospital. After all, the doctors are pretty limited these days. Staff are overworked. They're, understaffed, all this kinds of things. So you really want to keep yourself out of the office as much as possible, especially to wait a little bit, and the appointment is unnecessary. It's not fun. Anyway, so with that being said, you want to make sure that you have a chief complaint. The second thing, and the third thing, is that you want to bring a notebook. And I mean, how many of you guys actually bring a notebook to your medical office? I mean, raise your hand. Actually, I don't even need to see you guys raise your hand, because I know nobody does. Nobody. Nobody brings a notebook. And even if they do bring a notebook, and if you want, leave your comments down below. I would love to hear if any of you guys actually bring a notebook to your medical offices. Now, everybody has a theory on why they don't bring their medical, or why they don't bring a notebook with them. But I'm going to tell you this. My theory is that you guys don't bring medical notebooks because you don't know what to put in them. So I've designed a little cheat sheet of how to write an entry, what to put in, today's date, and then what kind of structure you should have your entry to be. That would be noteworthy. It wouldn't be just like just a mess. It's a good note, kind of like how you would write notes when you were in school. You want to have a notebook that's pretty, easy to understand, that you can just flip back to right before a test, 5 minutes. And that's a kind of note that your entry you're looking to put into your notebook. But I believe that a lot of people don't bring their notebooks. And that's because, well, they don't have any way to, write an entry. And so what's the point of doing it? And besides, it's all a big mess anyway. So again, that would be the third thing. Now, that is pretty much what the certificate means, is that you have these three things. You have the standard care. Of course, you know a lot more, but you are going to be able to show the doctor straight up right away. I know how to work my portals. I have a chief complaint, and this is why I'm here. And I have my notebook so I can take notes, so I can remember and get more information from you during this appointment. And that by far scores with the doctor. They will love you so much. And with that certificate, you might not even need to have it. You might not even have to have your card, because they, just by you performing these three things and how their office is going to go, how that appointment is going to go. And needless to say, these are going to bring on a lot of really good things that comes your way by being able to do those three things, being certified in it, that somebody actually recognizes, yes, you are certified, you know what to do, and you know how to do it. That's going to bring you a lot of communication. And I'm going to say this. I was on LinkedIn the other day, our Mother Month or whatever, and somebody said, hey, I don't have to fill out the paperwork again, because every time I go to the doctor's office, I have to fill out the paperwork. And I'm a cancer survivor, and I just can't relive it again. Unfortunately, the paperwork is necessary. It's a way that the doctor can communicate with you, and it's the ability. And the best thing about it is that they have it right in their practice. So what you're thinking about at the time is going to go basically on that street, right on that sheet. But the issue is that if it doesn't go on the sheet and you refuse to fill it out, that means you're not compliant. Obviously, you're not going to be certified if you refuse to fill out these sheets, but this is a perfect way for the doctor to communicate with you. And when you have the certification, you have the basic knowledge and education to be able to, write them down and go through them. And cancer is kind of, it's, any kind of complex condition, any kind of complex diagnosis, it's tough. It's going to be tough and it's going to be resonating with you for the rest of your life. But what that does is you have to always maintain it. You have to revisit. It's going to be part of you, kind of like a weight loss journey, right? You lose 100 pounds. That doesn't mean that once you lose the 100 pounds, you're all over. No, that doesn't mean anything like that, right? You have got to, uh, you've got to control your weight. You've got to do the diet and stuff like that. Just like I was telling my husband, I lost a little bit of weight earlier this year, and he's like, okay, well, let's go back to our eating habits. And I'm like, hey, I can't do that, because if I go back exactly to my eating habits prior, then all of a sudden the next thing you know, it's going to be, I'm going to go back to square one, and you know, it's just not going to be able to do it. So I always have to visit that every single day and kind of maintain it. Of course, I have cheat days, but at the end of the day, it's always something that I'm going to have to remember. Of course, getting older has its own circumstances, right? Anyway, so with that being said, when you're certified, you're asking you're asking the right questions to the providers. You know which questions to ask, and there's nothing more frustrating to a provider if you are asking a specific question about billing or coding or something like that, where the provider is directly focusing on patient care, and you don't ask the financial experts about your bill, but you ask them about conditions. Those questions will never cross, and you'll never get the information. You want to make the most out of this medical appointment, and the more efficient you are, the more streamlined you are. And when you're certified, all of a sudden you're asking the right questions to the right professional. So important: the who, what, when, where, and why, and how to do it. Put down the entry, and I mean, your appointment is going to go so smooth. That is going to be, and by the way, I have some really exciting news at the end of this video. With that being said, you're going to be able to enhance clarity and accuracy in conveying symptoms and concerns. So, like what I was talking about, point two, having a chief complaint ready, that's exactly what we need to do. When we have that chief complaint ready for every office visit, and there is no reason why, if you don't have a chief complaint ready and you don't have a specific request of a follow-up office appointment from the physician, like word of mouth, then there is absolutely no reason for you to be in the appointment. None. So with that being said, you have your chief complaint ready, you have your symptoms. Know when, where, why, how. this symptom happens. So let's say you fell and you sprained your ankle, and you have to be able to convey the symptoms and the concerns about it. So I sprained my ankle 3 days ago. It's swollen now. I put it on ice. The pain scale is at about 8, and I can't walk on it. What should I do, doctor? And then they would be able to give you this. But you have that chief complaint ready. You know why you're in the office visit. You're able to convey and communicate those symptoms and what have you been doing prior to that. So I've been taking about 4 Advil, at a time for every 6 hours, just waiting for the appointment with you. So with that being said, you're able to get that and convey your symptoms and concerns. And then, of course, having all of this and having being certified and having the knowledge, streamlining your appointment, you're able to build or rebuild that one-on-one relationship, even if it's 2 minutes longer, for you and your physician to have that one-on-one interaction. This is where I'm at. This is what I need to do. This is where everything is going. Actually, I have an audience. I have a cat that's looking at me, and maybe one day you'll meet her. So with that being said, and I hope I have everybody's here attention just as much as I have hers. With that being said, you'll be able to convey your information and you have that interaction, that relationship, even if it's for a split second. You have that downtime, that quiet space with the physician, being able to convey that information, because as the treatment appointment is, you wonder where the red tape and why the rushing is and why they're on the computer so much. The reason is because of insurance, and the insurance demands and allots a certain amount of time for the physician. And when you streamline that time and you give like a split second extra, like a breather time, a little cushion margin in between spaces, you have that doctor's attention. Even if it's just a nonverbal communication, it is still the attention that you guys need, and to have those cues of that only a face-to-face interaction or telemedicine appointment can relate when you have that interaction. But you're relieving all of that because of this certification. And like I said, patient better, like I said last week, patient better is the gold standard of care. How do we know that? Because we have that 501c3 program that only does the research and the commitment and streamlines it and does the statistics on it. So that way, when we bring the education to you, we know we're giving standards. We know we're giving you today's education to navigate through the medical landscape more efficiently and effectively. And these are our numbers, and this is what we are achieving. So with that being said, you are building a stronger relationship and you are certified, so you are able to know how that goes. And then, of course, the best thing is streamlining your care management, right? So when you guys as a family, so there's more and more, you guys, I'm pretty sure most of you, if not everybody on this chat, knows that more people have more sophisticated responsibilities to having managed their care at home. What does that mean? That means that it's being relieved off of the doctor's shoulders and it's put onto you. So a lot of times, so your diagnosis is not, you can't do it by yourself. You need your family. If you have Alzheimer's, if you have late stage cancer, if you have, if you are giving birth, I mean, there's a lot of things that you can't do on your own, or extremely difficult to do on your own. Without having a facility or anything like that. The goal of everyone is to stay at home. Well, what does that entail? That independence entails a lot of responsibilities, and the less responsibilities we complete, the more quicker we're going to end up in a home. And so home care is the key to today's medical landscape, and you have to, and because of the doctors being more technology advanced, and because they're in that digital space, because you have all these devices, this care is sophisticated. With that being said, having a certificate enables you to understand how to complete sophisticated care at home. And you reduce, and with that being said, when you're able to give yourself more sophisticated care, and that goes with everybody, right? So, just like, let me give you an example. You go to somebody that's in their residency, and you have got very bad diabetes and you have got high blood pressure. A matter of fact, the last doctor you were talking to was on the teetering of sending you off to a specialist. Well, something happened to that doctor, and now you have a doctor that's in his residency. Okay. And that doctor has no clue of what's going on. That's kind of like the care delivery that you give yourself, right? So if you have no clue on what you're doing, then the care delivery is not going to help you at all. But if you have the education and the backup behind you, that sophistication of care delivery becomes more profound, and you're able to deliver yourself more care at home. With that being said, it's more independent. It means that you're staying at your home longer. It means that you're not going to become a burden. And that's what's really the important thing about that is. So home care is definitely the ticket right there. And with delivering more sophisticated care to yourself at home means the reduce of errors, oversights, and misunderstandings, right? So when you get that information, you have your notebook ready and prepared, you're writing a crucial entry. Then all of a sudden, the next thing you know it, you're at home. You don't have those misunderstandings. You don't have those, things that you forgot, those oversights that you had in the medical appointment, because you have them written in the entry, and therefore you reduce your risks of errors. It's that simple. Um, and we could talk about the cost savings. So with that being said, and this is probably what we say in most, if not all of our videos, people with chronic conditions are spending in out-of-pocket expenses that don't need to be there over $7,000 a year. So everybody, and the CDC claims this, so everybody with a chronic condition on average is spending over $7,000 a year on what? Medication misuse, rehospitalizations, more hospital visits, and unnecessary trips to the emergency room. Just on those four things. Those are the big fab four that I call. But we're not talking about additional home care companies coming to some people helping you with your ADLs, you going into your late stages or advanced conditions and stuff like that quicker. These kinds of things are happening, and it's averaging out to $7,000. So it's not just, and I promise you, you take one unnecessary trip to the emergency room, the disarray, the confusion, the agitation that you have on your family members, and all of that other stuff really comes into play for that unnecessary. And when you find out that it was an avoidable UTI or something that happened that could have been just avoided, when you have that information, you're like, okay, why did this happen? And then when you see the doctor bill, you even regret it even worse, I promise you. So this certification really just brings back what you need. And this is not, and if you think that it doesn't happen to you, believe me, it does. This is unwitting. The people are unwittingly doing this. So if they think that they are working on it, their chronic conditions to their ability and best they, if you can prolong your independence by 5-10 years, if you can prolong being a burden on your family or having to move in with your sons or daughters, or if you can avoid going into an assisted living center by cutting that off at 2-3 years, I mean, that's a no-brainer, right? You definitely want to have that education, and you want to have that backup. And like I said, we are the gold standard, and this is what we're going to do. And then, of course, the long-term health outcomes. So what I was talking about, when you have 7,000, you're spending over $7,000 a year. That's just numbers. That's a lot of pain, confusion, heartbreak, all of that stuff. No peace of mind, always wondering and worrying, stuff like that. You want to have the basics down and stuff like that. And so the long-term outcomes, if, like I said, if you're avoiding moving in with a family member, if you're avoiding having to go to an assisted living center longer, you're living more independently longer, not having to have outside companies come to your home. There's nothing wrong with that. But again, nobody really loves that. They would avoid it if they can. And that is the health outcomes you really want to have. You want to be able to, but here's the deal. If you get this program and you're certified and you go to these companies and you have that basic one-on-one, you're talking to them on a higher level. You're conveying information. You're speaking and you're communicating with them on a higher level, getting more things done and getting it done in a more quicker time. And you're avoiding misdiagnosis, everything like that, avoiding errors, oversights, and so many other things that without a certification and education behind that, you're avoiding a lot of things. So with that being said, let's wrap up for today. But here's the deal. If you guys have not purchased a health management starter kit, we are working on the FSA. I'm completely stoked and excited about that. So if you guys have an FSA account and you are kind of teetering on, when you're going to buy this, go ahead and DM me or go ahead and email me at the link that I'm going to provide you guys at the bottom in the comment section, and just let me know so that way I can alert you when my company gets on FSA. We're going to primarily do it on Amazon, but if you guys use something else, once we get certified with this, we will be able to do it across any platform that you have. And with that being said, guys, thank you so much for listening to my second show. I look forward to seeing y'all on Friday of next week. God bless and have a great holiday weekend. Take care.